If you're looking to work with someone who specializes in the treatment of OCD, please ask them questions. Ask them how many people they have treated who have OCD. Ask them, what kind of therapy do you use for OCD? Hopefully their answer is exposure and response prevention therapy. If it isn't, I would suggest looking for someone else to see you. Be sure that they understand what an obsession is, that it's an intrusive thought or image or urge. Don't be embarrassed to say, this is the kind of OCD I have. Have you either treated this kind of OCD before, or are you willing to treat this type of OCD as well? If anyone is offended by any of these questions, I think that it's best to look for a different therapist. I know that many people who have obsessive compulsive disorder have seen people who do general talk therapy. And general talk therapy for OCD isn't effective. In fact, many people I know who have OCD who have done that have gotten worse instead of better. So be sure that you know that the person who is going to treat you utilizes exposure and response prevention therapy, has treated people who have OCD or has training in treating OCD, and is comfortable and familiar with the type of OCD you have or is willing to work with that type of OCD. You might even ask, do you have a group of people that you consult with on cases? There are many different OCD consultation groups across the country that many therapists are involved in, and it's a great idea for them to do so because it helps them get a wide idea of ways to do exposure and response prevention therapy for obsessive compulsive disorder. Most important though, you have to be comfortable with the therapist that you're working with. You have to feel like it's a good relationship. So spend some time letting them tell you about the work that they do. Spend some time telling them about what's going on with you, and be sure that the two of you gel together well so that you will get the best results out of the therapy that you choose to do.